Zero Childhood Cancer program is a world-leading precision medicine program. It's led by Children's Cancer Institute and the Kids Cancer Centre at Sydney Children's Hospital. It's a national program involving every children's hospital around the country. It's a remarkable collaboration between clinicians and doctors working together.
At the moment, the program is limited to the really sick kids. Obviously very good for the cancer patients, any kid with cancer now getting access to the program, but how will that help research efforts going down the track?
So this program involves the detailed genetic sequencing of an individual child's cancer. It allows us to look for the genetic changes that are driving each child's cancer, and then wherever possible we can identify a treatment that matches, a drug that matches the genetic changes in that child's cancer. What we're learning from this extraordinary genetic analysis about the biology of children's cancer is huge. The more children that are enrolled on Zero, the more we learn, and therefore more children in the future will benefit from this program.
Can you tell us about a little child we've been following news of, Christian?
Yes.
Give us his example of what happened to him.
So this is an example of how we can match by identifying the genetic changes and then matching it to a drug, that we can get an extraordinary outcome. Now, this doesn't happen for every child, but in the case of Christian, he was diagnosed at the age of 15 months with a rare aggressive brain tumour called anaplastic astrocytoma. He was treated at Royal Children's Hospital in Melbourne. He had several rounds of intensive chemotherapy. That didn't work. The tumour actually progressed. It didn't shrink. He was given less than a year to live. Obviously, for parents, this is devastating news. He was then enrolled on Zero. His tumour was sequenced. We were able to identify a specific genetic change that was driving his tumour. There was a drug that matched that genetic change. There was a clinical trial open at Sydney Children's Hospital. He was treated on that, and within weeks the MRI scans showed that the tumour had stopped growing, and now he's 7 years old. He's going to school, he's living a full life. This is an example of how this personalised medicine can help children.
He's
with
a beautiful
cancer.
young boy, and hopefully we'll see many more Christians, right?
Indeed.
As this program is expanded.
Yes, so it's about the hope of improved outcomes, fewer side effects, but also the knowledge that we get for the future.
How soon can parents gain access to it?
So this is going to be rolled out progressively over the next 12 months. The Zero program has been open since 2017 for children only with the highest risk cancers. Yeah. Now this is going to be for every one of the 1,000 young people aged 0 to 18. The first cohort of children will be the children with brain tumours, every child with brain tumours in the country, and then progressively over the course of this year, groups of children with every other type of cancer, so that by the end of the year it will be available to every child in the country with cancer.
Michelle, why hasn't it happened up till now? Has it been staffing, money, progress in science?
Well, initially the first national clinical trial was a test of would this approach work. What we've been able to show with the high-risk children, that of the first 250 children who were treated on the program, of those who received their recommended treatment, 70% either had a complete remission, a partial remission, or their tumour was stabilised. So we have proof of principle that this precision medicine program could work. As a result of that, with the support of funding from the government and Minderoo, and the time it takes to scale up this program from the 150 children to 1,000 children a year, that's why we're extremely excited that this is about to roll out now.